Lansdown, one of the sports medicine surgeons at UCSF. I wanted to just review one of the recent research papers that we've published out of our group here. This was published in the Journal of Orthopedic Research and is titled Quantitative Imaging of Anterior Cruciate Ligament Graft Demonstrates Longitudinal Compositional Changes and Relationships with Clinical Outcomes at 2 years after ACL reconstruction. The anterior cruciate ligament, or ACL, is an important ligament in the knee. It provides the knee with stability for cutting and pivoting activities. Patients can often injure this ligament with activities like basketball, soccer, football, or skiing, or other activities that require cutting and pivoting maneuvers. After an ACL injury, we will often treat this surgically with an ACL reconstruction. With that, we will take a tendon, usually from the patient's knee, and then place that into the knee to substitute as a new ACL. After surgical treatment, that tendon tissue then undergoes a process of maturation known as ligamentization, where just the structure becomes more like a ligament. During that time, there are some compositional changes, including increase in proteoglycan, an important molecule in the tissue, as well as more organization of the collagen, some of the fibers that make up the tissue. After surgery, patients will participate in a rehabilitation program, and then we're usually trying to get them back to competitive sports activities by 9 to 12 months. And this timing is based on the functional control of the knee, the recovery of their strength, and then sometimes just based on time as well. And we don't have a great way currently to evaluate that maturation process as patients are undergoing their rehabilitation program. So what we did in this study was we applied 2 advanced MRI sequences. One is known as T1 row mapping and the other as T2 mapping. And these sequences give us a look at the biochemical composition of tissue. So T1 row reflects the proteoglycan content of tissue, and T2 looks at the collagen or orientation. So 2 of those parameters that we know are important as the graft matures. In this study, we followed 39 patients and obtained MRIs of their knees at 6 months, 12 months, 24 months, and 36 months after their ACL reconstruction surgery. And we looked at the composition of the ACL graft and how it changed over time. And what we observed is that the graft does change during this time frame with an increase in proteoglycan content and more organized collagen structure that really levels off by the 2-year time point. It does look like the T1 row and T2 sequences provide for a way to monitor these changes in the knee in a non-invasive and safe manner. Interestingly, we also found that these signal changes on the MRI at 2 years lined up well with how patients reported their knees were functioning. So the KOOS score is a survey that patients can complete that tells us how they're performing in sports, their symptoms or pain, their quality of life, and then how they're functioning in just daily activities. And we found that the KOOS scores, especially for the sports, so how well they're performing their higher level activities, really lines up well with these measurements of the ACL graft. So in this study, we found that we can monitor changes in the ACL graft that seem to track with that maturation process by using a non-invasive quantitative advanced MRI sequence to look at the composition of the tissue, and that these changes are really important because they do line up with how people are feeling after their surgical reconstruction. This is a technique that we're currently applying in a couple other research studies. One of our goals going forward will be to see if we can better determine when patients can safely return to activities to make sure that we're not keeping them out too long, but also returning them safely to sports and not placing them at a higher risk of re-injury. So thanks for your interest in this project.